All across the country, intensive care units have been expanded and hotels and congress centers have been converted into hospitals. All elective lists and routine clinics are cancelled and only urgent clinics and surgeries are still running. For us, this means a drop of over 95% of our activity. Private practices have basically shut down. At our practice, for example, we are following non-urgent patients on the phone and are only open to emergencies. We have made ourselves available to the health authorities and modestly try to support patients and colleagues by donating protection equipment, ventilators and any other requested items within our reach. Hospitals are dividing eye departments to work on a rotational basis. This avoids exposure to the whole department at one time point. And also rotational work allows for a group to sort admin from home when another attends eye emergencies and a third helps out in medical wards. There is absolute uncertainty on when we will be rebooking our clinics or surgeries or on how this will be done. COVID-19 is a huge challenge to all. Hopefully, we will continue to show resilience and find the way out. In the meantime, please take care and be safe.
I would like to tell you how we've organized our service due to the current situation by COVID-19. The first measure was to reduce the numbers of consultations and surgeries to what is strictly necessary, so we only attend to urgent cases. In addition, we made 2 groups and work 1 week on and 1 week off, so while half of the service is working at the hospital, the other half is working at home, calling patients, updating medication, taking appointments, etc. However, despite these measures and the fact that our area is not one of the most affected in Spain, 3 colleagues have already fallen ill. Those of us who continue to work in the hospital try to maintain all protective measures, although this being complicated by the generalized equipment shortages. The good news is that the cases are decreasing in our country, and I hope we all get back to normal soon.
I am a typical ophthalmology consultant specializing in cornea and uveitis with both public and private practice in Madrid, like many others. However, on the 14th of March, all of my normal life suffered a dramatic change. From this date, I have only worked as a full-time ophthalmologist in the private clinic where we attended to emergency patients. On the other hand, things have changed a lot in the National Health System hospital where I work. There, I only attend to ophthalmology clinic 1 or 2 days per week in order to phone my several patients, give advice, and plan any appointments. The rest of the days are like living a dream, due to the fact that more than 2,000 of COVID patients have had to be attended to in my hospital, which caused that the majority of the areas there, including the library, the gym, the theatres, needed to be converted into wards for such patients, with a lot of intensive care units. It was also needed to medicalize the hotels near the hospital, and it is in one of these hotels where I have to work the rest of the days. There we help as an internist specialist. Yes, as an internist. The situation is difficult too, because we haven't had enough protection equipment and tests. Besides, some of my colleagues are getting sick, and sometimes you have fear, but the necessity gives you the strength to go on. I don't want to finish without highlighting all the voluntary work that non-sanitary people are doing, remaining in their homes and making things like food and masks to help others, and of course, all of the work that all the healthcare workers from my country are doing, putting their lives at risk to help the sick.